Welcome to this capsule that will discuss the immediate management following a sport-related concussion. Hello, my name is Dr. Victor Lunn. I'm a sport and exercise medicine physician who practices at the University of Calgary Sport Medicine Center. In this presentation, I'm going to review 5 key aspects of sport-related concussion recognition and management. Firstly, removal from play. The players should be removed from sport activity immediately. Next, red flags. Identify signs and symptoms or red flags that should prompt an emergent medical assessment. Next, recognition. Assess the athlete for a possible sport-related concussion. Next is rest. If no red flags are present, the concussed athlete should rest from physical and cognitive activity for at least 24 to 48 hours. Finally, reevaluate. The athlete should be seen by a medical professional to guide their return to sport activity. So, red flags. Concussions can be caused by a direct blow to the head or an indirect transmission of force, such as a whiplash-type injury. Depending on the sport and how an athlete has been injured, there may also be other serious neck, spine, airway, bone, joint, and internal injuries. One should not attempt to remove a helmet or other equipment unless trained to do so. Don't forget to also follow basic principles of first aid with regard to airway, breathing, and circulation. Symptoms that may warrant an emergent medical assessment include the following. Number 1, if the athlete complains of neck pain or if there's tenderness to light touch of the neck. If the athlete describes vision changes such as loss of vision, double vision, difficulties focusing, or blurred vision. If there's any weakness or tingling or burning in the arms or legs, if the athlete complains of severe or increasing headache, if a seizure or convulsion was observed, if the athlete is showing decreased levels of alertness or responsiveness, if there's complete loss of consciousness, and if there's increasing restlessness, agitation, or combativeness. If emergent signs are observed and/or symptoms are reported by the athlete, an ambulance or emergency medical services should be called for appropriate transport of the athlete to an emergency facility for further assessment. I will now talk about recognize. If there are no concerning red flags, the athlete should be more thoroughly assessed for the possibility of a sport-related concussion. One tool that parents, coaches, players, and sport associations could use for recognizing a concussion is the Concussion Recognition Tool version 5. Also known as the CRT5. Trained medical professionals can also use the Sport Concussion Assessment Tool version 5, also known as the SCAT5, and for children, the Child SCAT5. Common signs of a concussion that one may observe include lying motionless or slowness to get up, if an athlete clutches their head or neck, if an athlete shakes their head, if the athlete appears to be confused, is incorrectly responding to questions, and show balance problems or stumbling, slurred speech, and if there's a scalp or facial injury present. Common symptoms that a concussion may report include headache, dizziness, nausea, vomiting, confusion, blurred vision, feeling foggy, and sensitivity to light or sound. If there are signs and symptoms suggestive of a sport-related concussion, then the memory of the athlete should be assessed with sport event specific questions such as, what is the date? Where are we playing right now? What is the score of the game? Which team scored last? And what team did you play last week? If a sport-related concussion is suspected, the athlete should discontinue any further sport participation and rest from all sports, exercise, and physical activity for 24 to 48 hours to allow concussion symptoms to improve. This includes resting from non-sport specific training and weight training. In addition, during this time period, the athlete should not be left alone for the first 1 to 2 hours. They should not drink alcohol or take medications or use recreational drugs that may affect one's level of alertness. They should also not drive or operate machinery. An initial 24 to 48 hours of rest from cognitive activities such as school and work may also be needed. Modification of school and work activities could include reducing the number of hours of school and work attendance, taking frequent breaks, working in a quiet environment, studying or working from home, and limiting time on the computer, tablet, and smartphone. Alternatives to school and work activities including watching TV or reading for short periods of time and playing cards or board games. Reevaluate. Following a sport-related concussion, it's a good idea to involve a healthcare professional in the management of an athlete's return to sport. Depending on the symptoms of one's concussion, the health professional may reassess some or all aspects of cognitive and physical function. So in summary, any athlete who is suspected of suffering a sport-related concussion should be firstly removed from play. Red flags should be identified. If no red flags are identified, then common signs and symptoms of a concussion should be recognized. If an athlete is suspected of suffering a sport-related concussion, they should be rested from physical activity and cognitive activity for 24 to 48 hours and be reevaluated by a medical professional to guide return to sport activity.